Welcome, everyone, and thank you for visiting our health center. My name is Elisa Jones, and I serve as the president and CEO here at Lancaster Health Center, where our mission is to achieve equity through healthcare that strengthens, welcomes, and allows our entire community to soar. Our purpose is to ensure that everyone has access to the care they need to get and to stay healthy. Lancaster Health Center is part of a larger movement of federally qualified health centers in Pennsylvania and across the nation. Community health centers are community-led, not-for-profit organizations that really embrace the integration of medical, behavioral health, social services, and dental care. And we provide these services in a culturally embracing manner. Every community health center is different, but we are all critical to ensuring we have equal access to care. We are thrilled today to have Dr. Rachel Levine and Governor Wolf at Lancaster Health Center to address critical components of the COVID-19 pandemic and how we can continue to keep our friends, neighbors, and families safe. I am delighted to introduce Governor Tom Wolf.
Thank you very much, Elisa, and it's really nice to be here, and thank all of you for being here as well. I'm here again for a couple of very simple reasons, but the first one, of course, is to say thank you to the healthcare workers, the folks who are on the front lines of this effort that we have undertaken to fight the virus, the COVID-19 pandemic. They're on the front lines. They put their lives on the lines for us every day, and I really appreciate that. And I think we need to show that appreciation and that gratitude every chance we get. And as Elisa said, right here, patients are getting especially good treatment. The hardship that the folks working here is really palpable. And this is true all across Pennsylvania. And again, I keep saying this, but medical professionals have come out of retirement to help all of us address this pandemic. Volunteers keep offering their time at every opportunity to assist people in need, and many people have taken on very different job duties or worked in different locations so that they could actually be of help in this COVID pandemic. And again, here at Lancaster Health, the workers have gone out of their ways to reach minority and vulnerable populations. And that includes the Latino community, and they've done this through targeted bilingual outreach and through advocacy. They're a federally qualified health center, FQHC, and Lancaster Health serves everyone with a sliding fee that makes health care accessible and affordable for everybody. This is really important. It's never been more important than through a pandemic, but it's important at every time. It's especially been key during this pandemic because it's allowed low-income Pennsylvanians in this community to take advantage of the health care that we all need as we go through this epidemic. They've also focused on things like contact tracing, and they've done that more and more and with greater efficiency and effectiveness since the time they first encountered this pandemic, this virus, in March. It's a testament, the center is a testament and a tribute to the commitment of a very caring community, as Elisa said. And I'm really proud, as I know everybody in Lancaster is proud of the important work that they do. So Elisa, to you and your team, thank you very much. Across the state, we are focusing more and more on doing the things that we can do to address this virus. And that starts with testing. We need to acknowledge that we have to do more and more, a much better job of increasing our testing capacity. And we want to continue to increase not only the capacity to do testing, we want to improve the turnaround time. I mean, right now we're paying the price for the breakout, the upsurge of cases in states all across the United States because national testing services are taking sometimes up to 2 weeks to turn test results around, and that's unacceptable. Here, we are doing what we can to increase testing capacity, and also to increase the number of testing sites. We have, 440 some testing sites. We want to make that grow so that people can have access to testing in a convenient way. We're also working on trying to develop testing that can actually be turned around faster, can be administered more easily than the tests we have right now. Again, one of the challenges we all have is that we're a bit at the mercy of what's going on in the rest of the country. And we're paying, with test results taking as long as they are, for the irresponsibility that other states have engaged and employed to ignore the problem and the threat of this virus. So we are continuing to look for ways to make testing right here in Pennsylvania better, easier, and get the results faster. I want to make sure that here in Pennsylvania we have one test lab in Exton, and we turn our test results around no longer than 24 to 48 hours. So we have that, but we don't have the capacity to do what we need to do. Right now, the biggest day we've had is 28,000 tests, but we need to get to double that, and we continue to work to get there. Testing locations are easy to find using a map from the Department of Health, and I think the Secretary will talk about that. It's important to go to a legitimate testing site and follow their instructions. The goal is for us to keep improving the convenience and the access to those tests. Right now, we're trying to hold back a wave. We thought we were doing a great job. We were. We were down to 300 to 400 new cases a day. We're now up to 900 to 1,000, 800, 900, 1,000 tests, new cases a day, and that is a problem. So we are taking action right now to make sure that we get through this as quickly as possible. What we don't want is what's happening in places like Florida, which is basically just let it burn. We don't want to do that here in Pennsylvania. We know there's a lag between the time you let it burn and the time you face the consequences. We want to nip this in the bud, and that's what we're trying to do. I am proud that we have the resolve here in Pennsylvania to act quickly, but there's no question about it. It is frustrating, and it is really hard work. We're all being asked to forego the things we love: athletic games, celebrations, concerts, going to bars, dinners out at a favorite restaurant. Those are things that we have to do, and if we want to meet the challenge of this disease. The enemy is that disease. It's not any segment of the economy. It's not any one person. It's that disease. We're trying to anticipate what it's going to do, what it wants to do, and we need that contagious disease, to keep from infecting Pennsylvanians. So once again, I want to thank everybody in Pennsylvania for doing their part. You're the reason that if we have success and get back to the place that we were in flattening this curve, it's going to be because of every Pennsylvanian doing the things that we're all doing here: wearing masks, washing our hands, practicing social distancing. If we're sick, we stay home. Those are the kinds of things that are going to defeat this disease. We need to keep doing that. And now I'm proud to turn it over to the Secretary of Health in Pennsylvania, Dr. Rachel Levine. Secretary Levine.
Well, good afternoon. Thank you very much, Governor. And thank you for Lancaster Health Center for hosting us today, and for really the life-changing work that you are doing for so many people. I had mentioned to them I am the biggest fan of FQHCs, federally qualified health centers, as is the Pennsylvania Department of Health. Lancaster Health Center continues to be a valued partner, especially during the COVID-19 pandemic, as they were actually the first testing site established in Lancaster City for COVID-19, and we look forward to our continued partnership. As of 12 a.m. this morning, we have 1,213 new cases of COVID-19 in Pennsylvania, and that brings our statewide total to 105,571 Pennsylvanians that have tested positive for COVID-19 in all 67 counties. Tragically, 7,101 deaths have been attributed to COVID-19. today, I want to walk through what happens after someone gets tested. So the governor mentioned we have well over 440 testing sites available in Pennsylvania. They include fantastic FQHCs like Lancaster Health Center. They include our hospitals and health systems. They also include CVS and Rite Aid and Walmart and other testing sites. We want anyone who believes that they are experiencing symptoms of COVID-19 to get tested. Testing locations are available on our website at health.pa.gov. When an individual tests positive for COVID-19, that test result is reported by the laboratory to the Pennsylvania Department of Health. Once that result is received, then a case investigation is started as soon as possible, within 24 hours of receiving the report of the positive lab test. Case investigations are primarily done by state or local health department employees with a clinical background. We also are receiving some assistance actually from the Pennsylvania National Guard clinical staff with this work of case investigations. The case investigator conducts an interview with the individual to find out many different points. We want to know risk factors, where that person may have been exposed to COVID-19. We want to know demographic information and clinical information about the disease status of the individual. We want to know their age, their sex, their race, their ethnicity. We actually are asking what are called SOGI questions, or sexual orientation, gender identity questions. Their place of residence, how long they've had symptoms, what symptoms they've had, and then we input all of that into our database, our clinical database, NEDS. We also want to know who are the close contacts of that case during the time that they were infectious. Close contacts are identified as someone who was within 6 feet of that individual for more than 15 minutes while the person was infectious. Close contacts are at risk of contracting the virus, COVID-19. Once this information is collected, it's put into our disease surveillance system, NEDS, and cases are informed of their requirement to self-isolate. From there, the close contacts are identified and they're shared with contact tracers, so it's a two-step process. Within 24 hours of the close contacts being identified, our contact tracers work to reach out to those individuals, and that includes the outstanding contact tracers right here from Lancaster Health Center. Contact tracers will call those individuals that are identified in order to inform them that they have been identified as a close contact of someone who has tested positive for COVID-19. Now, this is done in which the identity of that case, the identity of the person who was positive, is not shared. We enroll them in a monitoring system. The one we have for the Pennsylvania Department of Health is called Sarah Alert, which will check in with the individuals in quarantine to assess their status, all actually automatically. Contact tracers also do follow up with individuals who do not want to be enrolled in the electronic monitoring system. And lastly, we provide them with quarantine information, which requires them to stay at home for 14 days after their last exposure to the known case. Now, if this is a household member, it's really their last exposure to the case, so it could actually be more than 14 days, depending on how long that person has symptoms. The case investigation and contact tracing process is really an integral part of public health. This is not new for COVID-19. This is the type of investigations we do if we have a case of measles. This is the type of investigations if someone has a sexually transmitted infection. So this is bread and butter public health, but it has been certainly highlighted given the size and scope of the global pandemic, COVID-19. Now, we have had some concerns and issues with people who don't answer their phone when the case investigator and contact tracer call. And we have other ways of trying to reach people. We can use email, we can use letters. But it really is very important that individuals answer those phone calls. The information that is provided could save your life or the life of someone that you love in your family. So thank you very much. I'd now like to introduce Anne Marie Derrico. She is the Chief Medical Officer here at Lancaster Health Center to talk about the contact tracing work that I just spoke about for Lancaster County through the Lancaster Health Center. Thank you very much.
Well, thank you, Dr. Levine. It is a privilege to share the podium with you, and I want to thank you for the consistent and valuable updates in education that you've provided throughout this pandemic. There were many times that I attempted to emulate your calm demeanor as I shared information with our staff. I'm Dr. Anne Marie Derrico. I'm a family physician, and I'm the Chief Medical Officer here at Lancaster Health Center. From the beginning of the COVID-19 pandemic, Lancaster Health Center was prepared to be here with and for our community. In early March, at the onset of the pandemic, we implemented a COVID-19 response plan in order to protect the health and safety of our patients and our staff. We opened our doors as the first COVID-19 testing site in Lancaster City. We embraced telehealth as a means of caring for patients for whom it was unsafe or unnecessary to come into the health center. We initiated contact tracing for our COVID-positive patients and provided culturally appropriate education to help mitigate the spread of COVID-19 in our community. To date, Lancaster Health Center has had an 86% success rate with contact tracing. And we launched a grassroots marketing and social media campaign to reach out to our non-English speaking neighbors who didn't have a primary health care provider. All of these efforts have contributed in reducing significant health disparities that affect the most vulnerable patients and community members. Our patients and community turn to us when they're sick or they're scared. We continue to make every effort to break down barriers to caring for those who have experienced symptoms of COVID-19 and to provide humanistic care during this uncertain time. Any patient or community member who's experiencing symptoms can schedule an appointment with one of our clinicians and see them in person or virtually, provide a free COVID-19 test if appropriate, and we will follow up with them to check on their symptoms and general health and wellness. If a patient tests positive, we continue to do aggressive contact tracing in order to mitigate the spread of COVID in our community. As you're probably aware, contact tracing is a tried and true public health tool that's used to spread diseases that are transmitted person to person. By quickly identifying a person with COVID-19, our contact tracers encourage that person to isolate until they're no longer contagious. In addition, they just as quickly find and reach out to their contacts to encourage isolation and self-monitoring in order to limit the spread of COVID-19. While we have been focusing on COVID-19 care for the last several months, we haven't forgotten about primary care, and neither should our community. Our health center, like many other health systems, have both telehealth and in-person appointments to meet all of our community's healthcare needs, including well child visits and immunizations, preventive adult visits, dental care, behavioral health care, and social support. And for anyone who has lost their health insurance, we're here for you. Whether you're sick and need care or testing or you need a primary care provider, we're here to care for you. Now I'd like to introduce Nicole Ibide Rodriguez, who's one of our outstanding nurses who's been on the front lines of our contact tracing efforts.
Thank you, Dr. Derrico. Good afternoon y muy buenas tardes a todos. As a nurse and patient care coordinator here at Lancaster Health Center, I've experienced firsthand the importance of making contact tracing calls and COVID-19 follow-up calls to check on the health of our patients who are recovering in their homes. For myself, particularly our Spanish-speaking patients. As the first health center in Lancaster to initiate contact tracing, this concept was unfamiliar to many in our community, especially those who were receiving the calls. I recognized immediately that our grassroots care and warm approach activated familiarity and ease with families. This solidified trust and opened up more conversation, which is a critical component to successful contact tracing. I've likely called some of you who are watching right now. Como el primer centro de salud en Lancaster, al comenzar el rastreo de contactos, la idea no era familiar para muchos en nuestra comunidad, especialmente aquellos que recibieron la llamada. Reconocí de inmediato que nuestra atención de inicio y nuestro enfoque cálido activaron confianza con las familias, lo que abrió las conversaciones, una parte crítica para el búsqueda de contactos. Es probable que yo haya llamado a alguno de ustedes que están viendo ahora mismo. If you could take away a few things from everything that you have heard and that has been said today, I would say that contact tracing, social distancing, and wearing a mask saves lives. Don't hesitate to keep your loved ones, your family, safe and protected. And please, if someone calls you to follow up with your health or to contact trace, feel free to ask as many questions as you want. We're doing this for each and every one of you. Si pudiera sacar algunas cosas de todo que ustedes han escuchado hoy, diría que el rastreo de contactos, la distancia social, el uso de una mascarilla, sí, salvan vidas. Nunca dudas en mantener sus familias seguros y protegidos. Y por favor, si alguien lo llama para hacer un seguimiento de su salud o rastreo de contactos, no duden en hacerlo todas las preguntas que ustedes desean. Estamos haciendo esto para todos y cada uno de ustedes. Thank you y muy buenas tardes a todos. Governor Wolf?
Nice job. So any of us would be happy to take questions? Yeah.
Either one of you. Today was the deadline for the mandatory universal nursing home testing. I'm wondering if you could weigh in if everyone's complied and the status of that.
Yeah.
So you're correct. Today is the deadline for all of our nursing homes to have all of their patients and all of their staff tested. We're doing really well. I mean, data is still coming in today, so I don't have final numbers. I know that as of this morning, 80% had fully completed. But we do have two groups that will linger a little bit into next week. One group is those facilities that have tests pending, meaning they've obtained the specimens, but many of those specimens were sent to LabCorp and Quest and other commercial laboratories, and through no fault of the facility, the tests aren't in yet, but they'll be coming next week, so that's fine. The other is we have had a contract with CVS Omnicare to obtain specimens and then run them. They actually do also send them to Quest, and some of them have scheduled since the beginning of next week. And so they're coming. And so we expect that between all of those lists, we're going to complete our task, and we're going to have a report out when I do my press conference on Tuesday.
Any results so far?
Well, we have been getting results all along. So we have seen an increase in terms of the number of patients and staff, and we expected that because we are testing everyone, and we are having asymptomatic patients and asymptomatic staff, which is particularly what we're looking for, so that we can do appropriate isolation, quarantine, and cohorting in the facilities to prevent the spread. So that's exactly what we've been seeing. It hasn't been massive increases, but we expected to see some cases, and that's why we're doing the testing. When we complete the testing, then we're going to go back and be looking at all the variables in terms of their test results, their previous history. We're going to be looking at the counties that they're in and the prevalence of COVID-19 in those counties, and determine when they need to retest. But this is not a one-time process at all, and we're going to individualize that to the results that are in the facility as well as their location. Yes?
Understanding a lot can change between now and the start of school. School districts are rolling out their plans, voting on their plans. And we heard a lot this week, several districts say, especially in southeastern PA, say the guidance that came out last week changed their minds and they actually backed off a 5-day week and went to 2-day week, pointing to the 6-foot guidance. Is that kind of the intent of that? Was it meant to be strengthened? The phrasing kind of changed of 6 feet where feasible. Just kind of curious the nuance that goes into that.
Well, so the 6 feet was really the best public health advice that we have, is to stay 6 feet apart. This is not different than everything we've been saying all along. It was in the original CDC guidance of 6 feet, and that is what has been accepted by the CDC all along. So the purpose was not to ask the school districts to do a hybrid program. The purpose was to keep the young people 6 feet apart and 6 feet apart from their teacher, which is proper social distancing.
The back end of that sentence, the where feasible. I think a lot of districts are getting nervous about that. They feel that there's more emphasis on the front and not on the back. How do you feel about masks, shields, sneeze guards? Is that enough protection if a district doesn't have the space but does have that?
Well, we want them to do everything they possibly can to protect the children and the teachers in schools. And so, 6 feet does mean 6 feet, but there are other ways to protect children. And so they need to develop a plan for their school district and then present that to their school board that does the best it possibly can to protect the health of the children and the staff and the teachers in the schools.
Can I just add something to that?
Yes, sir.
I mean, I think we're dealing with two realities here. One is the reality of the virus, and what does the virus want us to do? What the virus wants us to be close together. The virus does not want us to wear a mask. The virus wants to make anything we can do to make the transmission of this disease easier. The second reality is whatever we do, school opening is going to, in each school district, is going to depend pretty much on the confidence that the parents and the teachers and the administrators and the students have in terms of going back into the buildings. And that keeps changing. One of the things that I'm trying to do with, that we're both trying to do with addressing this upsurge that we're seeing in Pennsylvania is to try to make people feel comfortable actually going back to school. But in the end, that's what's going to determine this. Right now, where we are, there's been a 7% increase in the parents who are actually taking the cyber charter option so that they can stay home and not go to school. So those are the realities. The virus, what the virus wants to do and what the virus will do in terms of infecting people, we need to anticipate that and try to figure out how to make that really hard for the virus to do. The second reality is we need to make people feel confident in going back to school, or they're not going to go back.
If you could quickly talk about the reality of juggling, the need for kids to have in-person. I mean, so many, this is a juggling act for you guys, for Secretary Rivera. If you could just talk about how hard that is for you.
Yeah, I mean, it's a great question. The sort of pedagogical theories, which I have to admit I'm not the strongest on, but I think what I do know is that we need our kids to get an education. We cannot interrupt it. That's going to be bad for all of us. On the other hand, we're all grappling with the challenge of this pandemic, and we need to do everything we can to keep people safe. So once again, we're faced with not a good choice versus a bad choice. It's two bad choices. What can we do to reconcile this or work through this really tough situation? That's what I'm trying to do. We want kids to learn. Pedagogically, I think it makes sense to have a combination at least of online. There are a lot of things that students are already doing online to learn, from the Khan Academy to cyber schools. But I think the socialization, the working together, the actually being in a classroom setting, seems to me that was great when I was going through education. It was great for my daughters when they were getting a public school education over in York County. And I think that's important. So to the extent, recognizing the reality of this pandemic, to the extent that we can get kids back to education as we need it to be, the better we're going to be. Yeah.
Governor Wolf and Secretary Levine, a lot of attention has been paid to bars and restaurants this week. Is there a specific metric that you're looking at that would lead you to ease restrictions on those bars and restaurants this week? Yeah,
well, we're looking at data. There is not one metric. And let me tell you why. One of the problems with the coronavirus is there's a lag. I think if you recall, places like Texas and Florida, even Arizona, we're all looking at data and saying, you don't have a problem. And then all of a sudden they did. And that's the problem with this virus. You know, you can sort of go along, and it takes, 2 days to 2 weeks for symptoms to actually appear. Sometimes they never appear, but if they do, it still takes 2 days to 14 days to appear. So you could be going along blithely saying, nothing wrong here, and all of a sudden, boom, your healthcare systems are overwhelmed. You have people dying. Your morgues are not big enough to handle the death rate that you're facing. I don't want that to happen in Pennsylvania. And back to the education, I want people to feel that in Pennsylvania we're doing things that make it so that we never get to that point. So we use data, and we base the decision to target things. Contact tracing has helped us understand that where people come together, they talk loudly, and they spend a lot of time together, that's where the virus is going to actually spread. Now, if it's, that is something that we know. We track I'll let you talk about the data we look at, but this is why we can do things now that we couldn't do back in March or April, where we had to do a broad brush. We actually know more about this disease. We know where it's coming from, where people are contracted, and to the extent we can focus on those areas, not targeting restaurants or bars, but targeting that virus, saying, where is it you'd like to hang out? That's what we need to stop, or we're never going to get back to life as we know it. I want this to go as quickly as possible, and I think what we've learned is decisive action is what we need. So, you want to add anything to that?
So just to echo what the governor was saying, I mean, we have taken a data-driven approach all along. There is not a specific metric at which point we would say that the restaurants can open up more or the bars, but we're going to be looking at trends, and right now, unfortunately, the trends are still going up. Things seem to have stabilized. We're going to watch that in the Southwest, but we're having significant increases in the Southeast, really throughout the Southeast. And I gave evidence yesterday in terms of the percent positivity, and that has gone up in Pennsylvania, and that has gone up actually in the state. It had gone up in the Southwest, that's gone up in the Southeast, and even a little bit in the South Central counties as well. So what we need to see is everything going in the opposite direction. We need to see decreases in terms of the number of new cases throughout the state. We need to see decreases in each county and region. We need to see the percent positivity go down. To highlight what the governor said, Dr. Birx had said a day or so ago, is that what states need to do is pay attention to those details, those exact details that I'm giving you, and not wait till the cases are doubling and going up exponentially and then threatening things. I mean, when things go up in that exponential rise, they get pretty quick. 1,000 cases a day is 2, and then it's 4, and then it's 8, and then it's 6, and then Florida had 15,000 cases a week or so ago in one day. So you do not want to wait, and it's very, very difficult to control. And so that's exactly what we've been doing. We did not wait, and we took assertive action before we saw those type of increases.
Just with that, is there, again, a specific number that we're looking at that you'd like to get it under, that maybe we open up those bars and restaurants more?
Sure. Well, I mean, a general percent positivity, which is kind of a cutoff, is 5%. And so when you're lower than 5%, we're doing better, and when we're above 5%, we're not doing better, and we're at 5.7%, I believe. I probably actually have exactly those, if I can find it. So in Pennsylvania today, we're 5.7%. The Southwest is 6.9%. The Southeast, 6.2%. South Central, 5.9%. And so, but we have seen increases in every county and every region. So even though other regions might have a lower percent positivity, under 5%, we have seen counties where there are increases. And so that's why we took the full state approach with this targeted specific mitigation.
So would it be safe to say that once we go under that 5% positivity rate, the restrictions on bars and restaurants could ease?
I don't want to make that promise. We're going to watch the trends. We're going to see when that happens. We'll see what's going on in the rest of the state, as well as all the data.
As quickly as we can.
As quickly as we can, as the governor said.
Sorry, just while I have you, this
Sure.
is something you talked about yesterday about the states on the quarantine list, that the PA Department of Health is not enforcing that. Is that up to employers, or who is that up to enforce if someone travels to one of those states on that?
Governor, why don't you take that?
That's up to each individual. If you've gone to a state that we identify as a state that is of concern, and we keep changing that every week, then you owe it to yourself, to your family, to your loved ones, to your coworkers, self-quarantine. Yeah. I'm sorry, I got you.
Go ahead.
Go ahead.
I had asked Dr. Levine about this yesterday, but wanted your input as well. As more states are starting to enforce their mask policies on everyone, is that something that you would consider in the future, or what are your thoughts on that now?
No, I mean, we're enforcing it now. I think what you got to recognize is there are only so many police officers out there, and there are only so many hours in the day, and there's so many things that they're all trying to do. So the amount of time that they can spend devoted to enforcing anything that's in place, including stop signs, for example, is going to be limited. What is going to happen is the same thing that happened with seatbelts, and that is that people recognize that they got to do it, and that you know, it doesn't matter what I say, it doesn't matter what she says. What matters is what the virus is going to do, and that virus really doesn't like it when you wear a mask. So we ought to wear a mask. And we're now up to, I think, 75% polls show people are wearing masks. What was it 2 months ago? Probably close to zero. So we're getting better. And it's not because of any enforcement. It's not because I made it mandatory how many weeks ago. It's because people are saying, yeah, this is a good idea. And that's what's going to make this work. Yes?
Hi, Governor Wolf. My question is on House Bill 2463. I know that you have...
Please tell me which one that is, because I know I'm only been in politics for 5 years, so I'm not sure I understand or memorize. I have not memorized the numbers.
Okay, that's the one on the disaster declaration.
Oh, okay.
Okay, yeah. So I know you said you plan to veto that bill, and I know you have 10 days to either veto it or sign it into law. So 10 days will be Sunday. So my question is...
I think you're talking about the right to know law.
Yes.
Yes. The right to know law, right. I've said I'm going to veto it. I signed a bunch of bills yesterday. I did not veto it. And I do have until Sunday. And the concern I had was, and this is I am absolutely for transparency, but I'm also for keeping our employees safe. And I didn't see, and I still don't see, how you can actually say, I don't care whether it's a pandemic, whether the building's closed, whether it's blown up or what, I need you, the employee, to go to work and get the information that somebody has asked for. That's not something that I can go for. Now, to the extent that I can be persuaded that this law allows that to happen, either in the way it's implemented, then I won't veto it. And so I have till Sunday, and I'm working very hard to see if I can keep employees safe. If I can, I'm fine with this. As I said, if I were a member of the legislature, I would have voted for it too. But I have to take responsibility for the people working in the Capitol, in the state, and there's 70, 80,000 people who depend on me for their safety. So if I can be assured that this can be implemented in a way that is safe for the employees, then it's not a bad choice. It can't be. We got to be able to do both. We got to be able to be open and transparent and keep our employees safe. Yes, and I'll come back. Yeah.
So you're in Lancaster today, where Republican
and you pronounced that correctly.
Yes.
You know, I'm half Lancastrian. My mother's from Lancaster County.
Good to hear. So you're in Lancaster today, where Republican lawmakers and local officials have constantly been asking for local control about the coronavirus response. And when they have had control, like how they've spent the CARES Act dollars, the $95 million with their Penn Medicine partnership for contact tracing, etc. They've had some success with that program and that partnership. Are you going to make any changes and allow any more local control for future outbreaks, or instead of these statewide orders?
I think there's a combination. Right now we have a combination of both. In fact, with school openings, we're letting schools make that decision. One of the things that the problems with this virus is it doesn't respect state borders. It certainly doesn't respect county borders. And I remember when we were back in the red, yellow, green phase, York County went to yellow before Lancaster County did, and I think they went to green before Lancaster County did, and that was a problem. Well, if you're living in Columbia, which is on the York County border, yeah, that is a problem. But if you're down in Quarryville, maybe there's a whole different situation. So I think there's certain things that require state action, and that's why I think this restaurant thing, because people do move across state borders, and as the Secretary said, we've had outbreaks in every region of the state, and so. In some cases, I think state action is appropriate. In some actions, like how to spend the CARES money, I think it's great that Lancaster has figured out what's appropriate right here, and I think that is. But I think we've got to all recognize, as we look through any crisis, there are some cases where that county boundary is relevant, and some cases where it's not.
On the restrictions on out-of-state travel, because you mentioned that seems to
right.
maybe be contributing to
Right.
some of this increase. How fluid is that? Are you considering other states right now? Are you taking a hard look at it? Or?
Well, first of all, it's very fluid because we look at it every week, and we apply. I think it's every week, right?
Friday, every Friday.
Every Friday we make the decision. So today, again, if you look at, I think there were 3 states, Connecticut, New York, and New Jersey, that said we're actually going to make this mandatory and put it into place and make it enforceable. But when they were asked, how are you going to enforce it? I think New York said, well, we're going to check license plates. I think New Jersey just said, well, we're not going to enforce it. So it's really something that we're doing to try to bring information to folks so that they can make informed decisions on their own. If they make if they don't care about their family or their coworkers, I think the majority of people aren't there. And I think the majority of people are going to say, yeah, I want to do the right thing. And if I've gone to a state where there's a bigger chance, I'm going to get tested. If I test positive, I'm going to quarantine myself, or I'm going to quarantine myself anyway. Those are the kinds of things we want people to make, the decisions they need to make or they make it because they need to make it. It's the right thing to do. Yeah.
Going back to schools for a second, I don't know who wants to take this. Yesterday you mentioned the waiver for 25 people indoors for schools.
You want, I think you want her to take this.
Whichever. And so with that in mind, and those of us who have been up to our eyeballs in this kind of understand that, but what is it about a school setting, what is it about precautions that are in place for schools that allows you to make that waiver for schools as compared to other places?
Well, I mean, I think the reason we would make that waiver is because the importance of schools, and because we are going to be working with the Pennsylvania Department of Education, as well as answering questions with the school districts. We're going to be talking to the superintendents, Secretary Rivera and I, because they are making many different accommodations and changes in order to keep children safe. And so I think that if you compare another indoor event versus school, the school is critically important, as the governor has been saying. So we're going to do everything we can to allow schools to be open for children and the teachers to be in school, or if school districts choose a hybrid. So we're going to do everything we can to facilitate that, given the realities of a global pandemic.
And a follow-up to that, is there, I guess, a message to staff or parents of it being safer or safe for students, more than 25 students indoors, if you know what I mean?
Well, that goes back to what the governor said, is that I think that the school districts and the superintendents, in collaboration with the Pennsylvania Department of Education and the Department of Health, we need to all work together so that the parents feel comfortable sending their children to school, that the teachers and staff feel comfortable that we're doing everything we possibly can to keep them safe in that setting. Sure.
And I don't know if you're the right person to ask this, but has there been any conversation about liability for schools if there is an outbreak? Or is that...
I'm definitely not the right person.
Actually, there's a robust conversation going on right now in Washington. And I think one of the things, as senators on both sides of the aisle talk about what the next round of stimulus looks like, the CARES Act money, that is front and center as to how specific areas like areas like this, I think for 5 years is the initial discussion, have some protection against liability.
Just curious, follow-up that I just asked, do you kind of have a message to parents, staff of the safety, of going back into a classroom and sending your kids back into a classroom? I know there's a lot of concern. People are.
At this point, my message is you have every right to be concerned. And my other point is that I'm doing everything to make the situation for you and your children as safe as possible. I recognize the concern that you have, and I think that's absolutely appropriate. I have children too. Now I have grandchildren. And I care very much about their safety, and I think every parent does. But we also want our kids to get an education. We want them to get a good education. So we are trapped between some really hard choices here, and that's, again, what justifies, I think, taking hard, dramatic action over summer break so that we increase the chances of safety when we get to the school year. Okay, thank you very much, everybody. Thanks.